Good morning. Welcome to our third Can We Talk? Conversations That Matter event, sponsored by the Human Resource Department, Diversity, Equity, and Inclusion Committee. My name is Naomi Benson. Would all the members of the committee please stand? Please join me in giving them a hand. We would like to thank you for joining us today. If you will, let's take a trip to the local grocery store. You put a box of cereal in your cart, but you are unable to afford the milk to eat with it. You have bread and jelly in your cart, but now the price of peanut butter has soared, and you are forced to leave it on the shelf. These are signs of food insecurity. The USDA defines food insecurity as a lack of consistent access to enough food for every person in the household to live an active, healthy life. In 2022, they reported the number of people living in food insecurity households in the United States increased to 44 million, including 13 million children. Today, our conversation, Are You Secure? Will focus on navigating the causes of food insecurity and overcoming its obstacles. Now I will ask Adrian Nickerson to introduce our guest panel that will lead this meaningful discussion, moderated by our committee co-chairs, Kim Coleman and Laura Cannon. Thank you.
Thank you, Naomi, for that introduction. Again, my name is Adrienne Nickerson. I will be introducing today's panel for today's discussion. First, we have Yvonne Conwell. Yvonne Conwell is honored to serve as the County Council Representative for District 7. She is committed to building an effective and efficient county government that continues to work every day for safer neighborhoods, stronger health and human services, and the inclusion of a vigorous business environment that promotes sustainable economic growth and equitable job development. Next, I would like to introduce Denise Cavanis. Denise Cavanis is an Information Services Supervisor with the Cuyahoga County Division of Senior and Adult Services, or DSAS. Prior to joining DSAS, Denise was the Division of Children and Family Services for over 25 years. Also with us today, we have Vaughn Johnson. Vaughn Johnson serves as Deputy Director for Economic Development with Cuyahoga County, with a focus on economic development lending, business retention and expansion, small business programs and initiatives, and he leads the Workforce Skill Up program. And finally, Vontrice Jones. Vontrice is the Director of Agency Services with the Greater Cleveland Food Bank. Vontrice oversees the food distribution, compliance, and relationships of over 450 emergency feeding programs across a 6-county service territory. Her role is to assure that food is distributed equitably to families in need and that partners are following all guidelines set forth by the Food Bank, Feeding America, as well as the state of Ohio and USDA. Again, let's welcome our panel.
Good morning. As Naomi shared this morning, a significant amount of people are struggling with food insecurity across the United States and right here in Cuyahoga County. Thank you all, our panel, for agreeing to help us shed some light on this topic this morning. While we have put together some questions, we want this to be a free-flowing conversation amongst friends. To get started, food we know is a necessity. However, a lot of families affected by food insecurity don't meet the federal poverty level standard. To our panel, is there a way for them to get assistance for their families even though they don't meet this standard?
I can share more information about the Community Resource Center. We had the ribbon cutting ceremony on the 1st, and it was open to neighbors as of yesterday. And so we're really proud of that new facility. It's a national model, actually, that provides additional wraparound services. And so it's really a one-stop shop for the community to be able to get those resources that they need and eliminates transportation barriers. So we have Metro has a clinic there that folks can receive health care should they need it. We've got CH in housing, Benjamin Rose, the diaper bank is there, towards employment. There's so many other partners. Shoes and Clothes for Kids moved their entire operation there. So a lot of folks are co-located in that one space. So, and then we also, I'd be remiss if I didn't remember to mention the market. So when folks come there, they can receive all of those services at one time. And so this, again, is a national model that we're really excited about to share with the community so that way they can get the resources that they need at one time.
I'd just like to add that 211, a lot of people, we market 211 very well, and so they have a list of the resources and, you know, where to go. We have the Veteran Service Commission. As we know, our seniors are proud, right? Some of them do not want to, they want to suffer in silence, I would say. And so it starts in a conversation sometimes. Many of them go to the senior centers because it's not directly showing that they need a meal. They can do other things, they can socialize, and so they feel comfortable in those settings. And so they may not share with the director of the collab or the center, but they get to talking amongst themselves. And, you know, that's the breakdown that allows them to be able to reach out and let us know that they even need help. So.
And so DSAS staff will go into various senior centers and will conduct the benefits checkup to connect the seniors and individuals with services that we have mentioned.
So I'm sorry, please.
I just want to add something. So this is a very important and serious topic. So I'm going to add something that might be a little bit lighter. So when I was about 10 years old, my experience and the first time I actually heard of food desert was on Thanksgiving. And we had a bunch of family over, and I was the last person in line to get food, and there wasn't anything left. So I thought, hey, this must be some kind of food desert because there's nothing left for me to eat. But I also remember my mom having to catch multiple buses to get to a grocery store, to get a turkey and other things to go along with, just so we could have Thanksgiving dinner, because the only places that I recall in our neighborhood were like little corner stores that had, you know, prepackaged items and different things like that that weren't necessarily fresh and healthy. This is really critical, and when it's my turn to speak, I want to share some, I think, some exciting information about how the county and economic development is supporting and addressing food deserts and food insecurity.
You know what, Vaughn? It's your lucky day.
Set that up perfectly.
You know, you teed it up. Now you can hit the ball.
I appreciate that. So, again, thanks for having me. I really appreciate this. And economic development, I like to say we play offense. You know, we're the ones that we get to go out into the community. We work with developers. We work with the city of Cleveland and other municipalities. But in this particular case, I want to share how the Department of Development is addressing food deserts and food insecurity. And one of the things that we do in development is we work with developers that want to develop grocery stores. And it's usually part of a larger economic development project. We partner with the city of Cleveland on these deals in the city of Cleveland, obviously, to provide incentives. The county provides incentives, usually in the form of a lower cost loan or other incentives that will make the project work. And Councilwoman Conwell, she knows all about this. So I might steal a little bit of your thunder. I want to share one project that we worked on, and that is Link 59, which is it's on Chester between 59th and I believe 63rd Street, where there's a office building, office space. They do research and development at Link 59, but there's also a Dave's there. And the county was instrumental in putting together that package, that financial package, along with the city of Cleveland, to bring that grocery store to fruition in an area that also is prime for additional development. So there's the new Magnet office is right across the street from that. That Dave's is one of the most popular ones in there. If you haven't been there, I encourage you to go there. So the Department of Development, in that case, worked with the city of Cleveland to put together a package to make that project come to life. And then the other one I wanted to mention is the Meyer grocery store that's on 105 and Cedar, which is almost complete. That's going up. I know Councilwoman knows about this one as well. And that is another project where there's a 40,000 square foot grocery store, as well as apartments above that. And the reason why I mentioned 40,000 square feet, because many grocery stores are downsizing in terms of square footage. But this is a very large grocery store for that particular area. And then that grocery store will have other amenities there. And what I also wanted to mention about Dave's real quickly too, if I could just go back to that, is it's not just a grocery store. There's a pharmacy there, there's a bank there, because what we've learned in our studies is many times when there's a food desert or food insecurity, you also find in those areas, a lot of times there's no banking institution there. Those people, the residents are unbanked. So as we look to have a grocery store, we want to talk to those developers about what else is going to be in this development or what else is going to be in that store. So two examples how the county really addresses food insecurity and food deserts is by working with the city of Cleveland, by partnering with developers that want to do developments in underserved neighborhoods, and putting together incentive packages to bring those projects to life. And those are just two that I wanted to share with you this morning on what our department does to address that.
I know we've talked about food deserts, and for people who may not know what that term is, can one of our panelists share what exactly is a food desert?
Well, I told you what mine was. It was Thanksgiving.
On a broader scale, Vaughn.
So basically, a food desert is lack of access to nutritious food, lack of access to affordable food. And when we look at urban areas, we're talking about within 1 mile. Is there a grocer within 1 mile where you can go get healthy, nutritious food? Lack of transportation is also a big thing that contributes to or makes a food desert when we're looking at seniors or disabled individuals. And we have a lot of food deserts in Cuyahoga County. I was looking at some data recently. I was familiar with Central and my community, Glenville, but just looking around there, Kinsman, Union Miles, there are many.
And if I could just add too that you're absolutely right that transportation also contributes to a food desert. And I know that this administration and Councilwoman Conwell knows this as well. They have retained a transportation consultant, if you will, Annie Pease, that's looking at how the county can connect residents to grocery stores, but also jobs. You know, you need to have, I think somebody up here mentioned about the keys to food security is, having a job, having access, those types of things. So the county does have their eye on transportation to help address the food deserts as well.
I just want to, I would like to add that the county planning department a couple years back did a study on food deserts. So we have a direction, we have a strategic plan and where they are. So that's a good thing that we know where our focus is.
I have a question that can, kind of a broad, wide open question, but wanting to know how the county partners with local communities to address food insecurity in metropolitan Cleveland, not just centrally located metro Cleveland, but the suburban areas, the working poor. I know, for example, I live in Lakewood. Lakewood has a community center that distributes food and stuff, and I know there's other entities, churches and so forth, if anyone wants to speak to that.
WRAA is one of our partners. Of course, the food bank is one of our partners, Hunger Network. Um, it's not easy, it's not hard for them to find us when there's neighborhoods. There's always people that are out here that are advocating and will come to council because they know that we give a good proportionate of funding. It could be better. So when Harvest for Hunger comes around again, I think it's in March or February, the drive, please give. Yeah, because it's very helpful. And so just want to share a little something light of what we're doing upstairs as county council. We see all the various departments having raffles, baking cookies, making me fat, but doing all the things that we put out a box and collect food, and we help and assist around that part of the year. But this year, county council has rolled up our sleeve, and we're actually we have a wellness room upstairs in our offices, and so when we have some downtime, we're putting together puzzles, and we're going to auction them off or sell them for the benefits of Harvest for Hunger. So we're very proud of that.
Very nice.
Come up and buy. We'll figure that out.
And just to piggyback on what we can all do, our HR team, a couple of weeks ago, we went and we volunteered at the food bank. It was very enlightening, inspirational, as we were preparing foods that they told us, oh, these were going to the senior centers. So we're putting together their lunch. And you could go to a senior center, you volunteer, you may visit family members, but you never think about where does that food come from. So we were really excited. So when we were there, we volunteered at the kitchen. We were in the kitchen on Coit. Is it hard to get people to volunteer, do you think, Von Treese? Or do more people want to volunteer around the holidays, and then on the other parts of the year, it's a little harder to get volunteers?
I would say our area is very, very generous in terms of donating their time, their monetary resources and things of that nature. We could always use more volunteers. It's really a great experience, and I'm not just saying that. It's a great experience to be able to volunteer in our kitchen and help prepare meals, or in our repack area to be able to pack boxes of food. But I would say that this community has been extremely generous to the Greater Cleveland Food Bank. And so if you're ever looking for a project for like your family, for your colleagues at your church, please make sure that you keep us in mind. I would also say that there was another part of your question.
Is it harder outside of the
Outside of the
holiday
holidays.
time?
Yes. Well, I would say we tend to see a bigger spike during the holiday season because, of course, with Thanksgiving and Christmas, it's more top of mind for people. But as all of you know, like, people are hungry every day. And so we do see an uptick in terms of food drives and wanting to, order turkeys and things of that nature. But year round, we do have I want to say maybe over 8,000 volunteers that come. We could always use more to be able to do more, especially during the summer months when a lot of times people are on vacation and forget that a lot of children are out of school, and so they're not receiving that free or reduced breakfast or lunch that they would normally get 5 days a week. And so it's always a great time to volunteer at the food bank, but holidays is peak season, but people are hungry every day.
Like me.
I would just like to add that to give a shout out to my colleague, Councilwoman Stevens, our Vice President. She goes monthly and she volunteers. So
I'm going to switch gears a little bit here. I think, we talk about the seniors and, I think particularly vulnerable in the sense of pride, shame, access, transportation, so on and so forth. So my question to you, Denise, is to speak about the effects on health outcomes of food insecurity and seniors.
Well, just looking at the social determinants of health, we know that the lack of access to nutritious food can have devastating effects on seniors. High blood pressure, um, cancer, depression, just anything you can think of, it's there. I don't know if you want to add more. I know Councilwoman Conwell and I actually talked a lot about this in the grocery store. I ran into her, and 40 minutes later, we finished our shopping.
Well, Denise mentioned definitely the medical piece of it. Um, if we don't have our daily meals, we're not feeling adequate, right? And if you have that on a consistent basis, you can only imagine what that's going to do to your body, especially when, this is why meals have been added to the school lunches for the teachers to be able to talk and speak to the kids because they weren't sure if every child was getting the same adequate food. So they wanted to make sure that those kids were ready to learn. And to be able to be ready to learn, you need a few things. You definitely need food. You need some good housing. You need to be warmth in that housing. So I don't have funny stories to share like Vaughn. To me back then, it just seemed like I was always hungry in the 70s. I remember it was food stamps back then. So we were a family that were that utilized that system. And so what pushes my passion every day is I've lived through it, so I know. Aging toward the seniors population in a little while. I'm still 21. But so I know, and we get all kind of calls upstairs. Lavine Ross, I want to give her a shout out. She is a gem. So when I'm in meetings or something like that, I might get a call or an email, and I just give it to her. I just put it on her plate. So it's not just us, that are out here. It's the team that's behind us that are making sure every day that they're getting connected to DSAS or not too much to Department of Development, but to Greater Cleveland Food Bank. But I'm very excited that you guys are a part of it because grocery stores are an important part. And so my kind of motto is when anyone comes to me first, instead of the administration, and says, hey, we want to do a grocery store, we want to do a project. I look at, and hopefully you will use some of this motto, I look at, okay, grocery store is great, but what else can we do that the county needs? I'll look at when they talk about hiring. Right. Can we hire people that are coming back and re-entering into society? Right. Is there some housing component if it's in a mixed-use building? Can you let one or two of those suites be low income for our residents that's in a homeless shelter? So I try to globalize it and get all that I can for those that are coming to the county for our tax dollars.
So let me just add too, in economic development, we don't lend a penny of taxpayer money unless it is creating a job. We actually have a formula that we use, whether it's a mixed-use development or other type of development, that for every job that is created, we will lend a certain amount of money for every one FTE. So to your point, we're not just lending money, we're lending money to create economic opportunity. We're lending money to create jobs, and not just regular jobs. I'm talking family-sustaining, wage-paying jobs so that people can eventually buy a house, buy a car, get to work, those kind of things. And then we hold those developers and those borrowers accountable for the job creation. My loan portfolio management team monitors this, and the county, we have clawback provisions whereupon we make loans and the covenants are not being met around job creation or any other type of that. So any other type of the covenant. So we are not just in the business of making loans, but we are in the business of job creation for the county.
And if I might add, I'm sorry, if I might go back, I would be, it's important for me being a social worker. I must go back to the model, looking at the basic needs. Food is a basic need. Food, warmth, rest. If we don't have those things, we can't work our way up and reach some of the other areas. So I think it's very that just speaks to how significant it is for us to be able to assist individuals and connect them so that they can have what is basically needed to live.
You know, one of the things that I've heard on this panel is there's a variety of organizations, community development corporations, CDCs, public sector, private sector. It takes a village to raise a child. Food insecurity and food deserts are not going to just be addressed by one entity, one agency, one person. Before I joined the county, I had the privilege of working for a community development corporation in the Buckeye Shaker area, and I was there when in the Buckeye Plaza, the Giant Eagle grocery store left. And I remember it was not just a grocery store, but it was also a pharmacy. And I remember the seniors that had their pharmaceuticals at that location, the food that was coming out of that location. I remember when it closed, and remember how abruptly that situation closed. But it was the community that rallied around. There were community groups. There were county council, city council, mayors, CDCs, and everything. Because I remember I would go to work, and when that store closed, I would literally see seniors in either motorized wheelchairs or otherwise, trying to get from where Buckeye, the Giant Eagle was, to the Dave's in Shaker Square. And imagine people doing that in inclement weather, and they already may have a disability or they don't have transportation or whatever it happens to be. And it was very, very sad to watch that. However, the community was able to accelerate getting a new grocer in that plaza, as well as a credit union in that plaza. And I mentioned the credit union because the products and services that that particular credit union offered align with individuals that have been underserved or underbanked. So I just wanted to say in our conversations, one of the things I've learned here today and what I wanted to share is it takes all of us to address this very, very serious issue, and not just me not having something to eat on Thanksgiving.
And to your point, Vaughn, when you think about community, many of our seniors feel invisible, unseen, that they've just been tossed by the wayside. And so I would encourage everybody to make sure that you're checking on your neighbors or your older adults in your family, or just throughout the community, to make sure that they're okay. That, do you need anything? I'm going to the grocery store. Can I bring you something back? When you talk about medication and having to make difficult decisions choosing between food and medication, or food and rent, things of that nature, a lot of folks need food in order to take their medication. We have a Food is Medicine initiative that partners with a lot of federally qualified health centers and other healthcare institutions. And so we found that sometimes physicians will say, well, the senior's not taking their medication, they're non-compliant. Well, they're not taking it maybe because they need to take it in tandem with food. And so those are things that, as we look out for vulnerable populations, making sure that seniors are still seen, heard, cared for. And so it's the little things, I think, that come together as a collective that we can do to make a difference.
To Voltree's point, my mom's a queen. She's moved in with me, so she gets all that treatment. So if you have a family member, that's part of the aging process. That's what we have to do, right? Because we may find ourselves in that same tangent. But to Vaughn's point earlier, in terms of the grocery store that left on Buckeye, it takes a village, but it's also, when you think about low income areas, we have to fight to keep those stores or get something right back in, because it's not another grocer. It's not very easy for another grocer to want to come in, or a developer, because they're a low income area and they're looking for dollars. And if they're only getting, I've been in those conversations where some areas are saturated with just getting once a month, right? Purchases. So they're less likely to move in those type of neighborhoods because of that. So yeah, we had one years ago. It was a food desert for many years in I want to say Saint Superior area, it's now a Save-A-Lot. And I remember the councilman of that ward, he talked to Dave. He had to talk to all of them, but because they couldn't expand or whatever, it still remained a food desert. And the only ones that eventually, this is before the Myers and East Side Market and all that wanted to come in, there was no grocery stores over there. But the not fast food, but you have fast foods, you have the little corner stores, you have convenience stores, which are not very healthy. And he had to speak to all of them, and nobody wanted to do it because of that once a month, kind of you know, coming in, whether it's from seniors, low income, or whatever. And grocery stores need to survive a little bit more with that. So he was eventually able to get Save-A-Lot. So not high quality in some people's eyes, but you have to try to fight. If you're in a neighborhood and you have a car and you can get to the grocery store, oh, they're going out of business. I can go a few miles up the road. To Von's point, there's many individuals that's going to impact. So
Well, grocery stores are an expensive model to run. And many grocery stores in many communities, not just Cuyahoga County, but across our country, it takes incentives for those grocery stores to survive for a variety of reasons. So it's not easy, but when a grocery store is in decline, to Councilwoman's point, that's when the community and other people need to step up and say, we need this grocery store to stay here and be here, and what can we do to keep this grocery store alive?
So for our people in the audience and for our viewers, what can we do? Give us some examples.
Well, what we do
Call instead of call Councilwoman Conwell.
That's a good start, though.
Yeah, well, I think it's important to have the conversation, and this is where community comes into play. Connect with your neighbors. Make flyers, post flyers, contact your Congress people, even your local county council people, city council people. Get the conversation started. Have the right conversation with the right people. We can't sit back and just let it happen.
I would also add having a relationship with the local Community Development Corporation, the CDC. They have boots and feet on the ground. Most of them have their ear to the pulse of what's going on in that community, and they also have volunteer groups assigned. I know the Simon's grocery store that came in Buckeye, there was a volunteer group that monitored the progress of that store, monitored the quality of the food. They would talk to the proprietors about sales and customer experience and all those things to try and ensure the longevity of that particular store. So I would say reaching out to the local CDC in that community is a good place to start as well.
being a good neighbor and, just being vigilant on what you see when you go into a grocery store. I mean, we can't all do it all, right? We all have the same amount of hours in the day. So whether it's pick something on the continuum, whether it's volunteering at the food bank when you can, or being in community conversations, going to your work clubs when they're having these conversations, and bringing it to the attention of your local city officials that there's a need, talking with your neighbors. If you participate at a senior center and you volunteer there, ask what you can do. Harvest for Hunger. We can't do it all. Each of us can't do it all. But if we each take a piece, that continuum kind of comes together.
All good ideas. I have a question. It's really broad, but looking toward the future, how would a potential federal government shutdown impact childhood nutrition programs such as WIC, impact senior services? I know that I'm sure the county gets a certain portion of the funding from the federal government. So I'm curious to see what you think the effect would be of a federal government shutdown. I know today the new House Speaker said that he's considering rolling shutdowns of the federal government. So this is a realistic threat to food security.
I would say from the food bank standpoint, it would potentially put an enormous amount of stress and pressure on our network. We have over 1,000 programmatic partners throughout 6 counties, but food banking alone is not enough to sustain the community. And so it, of course, has a ripple effect upon us all. We all saw what happened during the pandemic with COVID-19 and how many people found themselves not even knowing where to turn to for food and food resources, not having really any knowledge of like that network base because they haven't had to. So I'll just kind of kick it off with that in terms of the food banking network is not enough to sustain, but that will have a lot of pressure on us and other agencies like that.
I would share that if that was a shutdown, and we don't know anymore, life is kind of ups and down right now since COVID-19, but as a community and in the conversations, we need to promote and really educate people how to do urban farming and plan for themselves, bringing in the agriculture because you gotta be a person for your own destiny. I mean, that's what kind of COVID-19 showed me. If something is not there, because we all experience the basic necessity of toilet paper, right? Nobody could get toilet paper. That was a high commodity. So just imagine if that was food. So we need to think about urban farming and what that can do.
Absolutely. And you just made me think of something. When the pandemic first started, like you all, my family panicked. What are we going to do? During that time, my husband and I started planting vegetables on our porch. We don't have a great big yard or farm or whatnot, but that's something that we continued even to this day. And it's also healthy. My tomatoes are sweeter. I cut my green onions probably 3 times a week. So that basically preparation, planning for the what ifs, whether you're stocking your pantry, with canned goods, and other non-perishables, or growing food, or I like to fish. I know this is something that we talked about previously, but that's also a way you can kind of help stock and prepare for the future. I think you can typically keep frozen fish in your freezer for up to a year.
And I know they have Ridall. I don't know if people have heard about Ridall farming. They educate. You can take tours. They can show you how. And I think it's over in the central neighborhood, but very awesome partners to show all of us. I'm not a green thumb and I'm not techie. Those are my 2 things. But I could probably do a lot better with the urban farming than I will ever with technology.
So for people out there who need help, we had a question when we were at the food bank. How do you have to sign up? Do you just show up? For people who don't know, what is that process?
If you need assistance and decide to use the Greater Cleveland Food Bank, we have our help center, 216-738-2067. So our help center is available to take calls, as I said before, over the phone. Or you can come in, they have walk-ins, or you can also make an appointment at our Community Resource Center at South Waterloo. That is where you would be able to go to get benefits. The Help Center is able to get your address or your current location and be able to tell you where there are emergency feeding programs in your neighborhood. You can also visit our website, greaterclevelandfoodbank.org, and so you can also hit a button that says Get Help. So there's a Give Help and a Get Help. And if you click Get Help, you will be able to see the emergency feeding programs within your community. They have the hours listed as well. If you can, call ahead. And so those are some resources. We also work in connection with 211. The Hunger Network is a great partner of ours as well. And so there's a larger network that if you don't have the resources you need, they're just a phone call away.
Patrice, can you speak to the mobile pantries that are?
Yes, absolutely. So we have a number of mobile pantries, which are fresh produce distributions distributed throughout the community. And so those are opportunities for people to go and get fresh produce that they may need for their family. So we have pantries, hot meals, shelter programs, mobile pantries. Senior markets that we also have, which is just a smaller model that wherever seniors congregate or visit frequently, like the community centers, they can also receive food there. School markets, school programming, summer feeding, after school programs, and things of that nature. So there's a larger list of services that the food bank provides throughout the community. And so if you call our help center, we can definitely connect you to resources. But that community resource center is really the one-stop shop that we're promoting to have people go should they need help.
I would also add, from the county's perspective, is to connect with the Department of Job and Family Services. They have a number of programs and resources for Cuyahoga County residents to get engaged in. I don't have all the details of their department, but I definitely know that that's one of the departments that residents can reach out to.
And if a senior or disabled individual needs assistance with completing any of the JFS applications, contact the Division of Senior and Adult Services, and we will be glad to assist you.
I think there's multiple places. We have it in the county libraries now. The food bank partners with that. DSAS, there's your community collabs. There's several ways to be able to access an application to get some SNAP benefits. Write your governor, tell him we need more money because we're a large county. You know, him and Fran are on the news about other things. Let them know that we need some more funding for seniors.
I have a real basic question, Von Treese. When we were on the phone, Kim, you and I, talking about the food bank and everything, and, we were talking about typical things that are donated, tuna, peanut butter, things like that. But the other side of that is, people will donate, for example, boxes of mac and cheese, and that's all well and fine. But if you don't have the butter or the milk to add to the mac and cheese, it's not much good. So can you speak to what your maybe top 5 items, most useful items to donate to the food bank?
Sure. Typically, like your canned meats, like your tunas, like canned products, soups, peanut butter, of course, like your pastas, your rices, things of that nature. Those are probably at the top of the list that people typically would like to be able to help prepare a meal. But if you have the funds to be able to donate or the ability to, that actually goes further than donating actual shelf-stable items. Because of our purchasing power, we can actually stretch a dollar further. And so what we find is that when we have our partnerships throughout the community, specifically pantries, we really advocate for the best model, which is a choice pantry. As part of that experience with having dignity to be able to go and get what you need for your family, is really much better if you're able to choose what's best for your family. And so when our partners order, we try to make sure that they get additional components and have things available that people can create a full meal with, opposed to just a one-off. Well, when we started out, with the opening, with you may have the jelly and the bread, but not the peanut butter. And so we try to advocate for choice, making sure that folks have a complete meal. But with those top 5 items, we know that a dollar can go further. But all the donations are welcome. We're grateful for all the donations.
Thank you. I also, because we had an interesting conversation this morning, about the transportation and the seniors and getting food to people who can't get to the facility, get to the muni lot for food distributions and whatnot. And you had mentioned that in particular situations, you've been able to connect DoorDash for certain residents that need assistance, that can't get to the resource center or the food bank. So that was like a light bulb moment for me. Had no idea. And there are a lot of, single people who are just very much alone. So that's really impressive.
There's some collabs that also have buses, and they deliver hot meals to the seniors that can't get out.
So our partnership with DoorDash has the Commodity Supplemental Food Program, which is a program for seniors 60 and over. So some of them who are homebound or have transportation barriers, we connect directly with DoorDash to be able to provide them a box of shelf-stable food along with a box of produce. And so we have those distributions at the food bank once a month. Maybe about 400 seniors receive that benefit. We have sunsetted the other program with DoorDash that we've had during the pandemic, where folks who were more vulnerable and unable to get out because of COVID. So what we've done is we've connected those folks to partners within the community. And so some of those food bank partners, they have home delivery programs. And so it's much easier for them to be able to get to a neighbor that's already in their community. And so they've taken on some of that additional responsibility of serving folks who are homebound.
Thank you.
Well, I just want to say I've gotten so much information today, and I hope that our viewers have gotten information how to get help and how to give help. I want to once again thank our panelists for taking part with us on this journey out of food insecurity. The title of our conversation is Are You Secure? So we want to hopefully make sure that all of our citizens around the county and the country and the state are secure. Laura and I would like to once again thank our committee for their hard work in putting this together. We will share, Ricky and Jonathan will share again some slides with information for contacting the Division of Senior and Adult Services as well as the food bank. And we would like you to also know 211, Councilwoman Conwell, 211, help 211, or the county offices. This is our third conversation. We will continue to have conversations that matter. We are tasked as a HR DEI committee with making sure that we promote inclusivity in Cuyahoga County and that we are diverse and we're equitable and we're inclusive and our employees have a sense of belonging. Thank you once again. And the next time someone asks you, can we talk? What do we always say? Yes, we can. Good night.
Thank you.